Hi, it's Dr. Shim Ching, board-certified plastic surgeon in Honolulu, Hawaii, talking today about cartilage. Why would I need cartilage for my Asian rhinoplasty? As we talked about in a previous video, the biggest difference between Asian and Caucasian rhinoplasty in general is that in Caucasian rhinoplasty, we're trying to reduce the size of the nose, whereas in Asian rhinoplasty, we're trying to make the nose actually bigger. Usually the areas are going to be the bridge and the tip of the nose. We usually need to make this part of the nose, we call the alar base, more narrow, reduce alar flare, the width of the nose here, but the other areas we're actually increasing the size of. So in the bridge of the nose, which is this part of the nose, usually the bridge is too low in Asians. This is the reason why Asians sometimes can't wear certain glasses, the glasses fall down just because they don't have enough of a bridge here to support some glasses. A low bridge makes the nose look flat, makes it look undefined, possibly less attractive in a certain individual. So most Asian patients want a stronger bridge. The bridge of your nose is made out of bone and cartilage here. I would say the top half to the top third of the bridge of the nose is actually bone, and then the remainder of the bridge is actually cartilage. So there's two sort of underlying structures that need to be built up so that the bridge is higher. And that's often the first thing that we address in Asian rhinoplasty. We want to build up the bridge and then the tip must follow. The two have to be in line with one another. It's very rare where I can only just build up the bridge of the nose. Usually the tip of the nose needs to come up as well so that it is in line, in balance with the newer bridge. There's a couple ways to raise the bridge of the nose, and the simplest one and the one that has been used over time for the longest time is a silicone implant. Now, silicone implants are very unpopular in the US, I've noticed. For whatever reason, the surgeons that are doing Asian rhinoplasty in the US seem to think that we should only use cartilage for the bridge of the nose. This is completely different in Asia, for example, where silicone implants are used all the time and are probably still the most common way to build up the bridge of the nose, just because it's fast, it's simple, it's a material that has been proven over time to be safe within the human body. And the biggest thing is that it doesn't require harvesting from another part of your body. The sources of cartilage in the human body for nose surgery are the inside of the nose, the septum. There's smaller pieces inside the nose that we can harvest, but usually they're quite small and just used for the tip. We can use ear cartilage, or we can use rib cartilage. Rib cartilage is commonly used for Asian rhinoplasty because it's a large piece. It can be made into slices, which are very useful to place in the nose. It can be carved into a piece for the bridge of the nose, but the downside of harvesting your rib is that you need to cut on your chest, and it's quite painful. It's quite a painful procedure to take out a piece of your rib, almost like breaking your ribs. If anybody's broken their ribs, they know how painful that is. This also adds considerable time to the surgery as well. So this is one real downside of harvesting your rib for this surgery, which is a very common procedure, especially in the US and other countries. In Asia, they still use a lot of silicone implants. And silicone implants are used for breasts, they're used for chins, these are used other parts of the body for augmenting, for reshaping, giving people more bulk in that area, and they work very well. So in my experience, I still use a lot of silicone implants. I think they work great. As long as they are done safely, and there are unsafe ways to do them, I feel that it's a very safe operation, very reliable. In some ways, it's a lot less complicated and less prone to complications versus using cartilage for the bridge of the nose. Cartilage in the bridge of the nose, for one, can warp, meaning it twists after it's placed in. It can resorb, meaning it gets smaller over time, so your augmentation of your bridge isn't quite as much. Whereas silicone implants are the same from the day you put them in to 100, potentially 100 years after. They do not change the body. I think there's a lot of talk about the silicone implants being unsafe, and that's why in the US, a lot of surgeons are not inclined to use them. I think the reason there is that a different type of implant was used about 20 years ago, and that's an L-shaped implant. And what that does is it puts a lot of tension in the tip of the nose, and that L is designed to project out, stick out the tip of the nose, which never really works. And those implants are actually prone to extrusion, meaning they pop out, they come out after a period of time because there's so much tension on the implant and the nose and the technique that was done. We know not to do that anymore. We use the bridge implant only to augment the bridge, and the tip of the nose is augmented with cartilage. We don't put a lot of tension on the nose with the implant. We actually use a silicone implant for the bridge, and the tip is made up of cartilage. When you do it that way, it's safe and there is no real risk of extrusion of the silicone implant in the bridge of the nose. So I hope you enjoyed this video. We talked about the bridge of the nose and Asian rhinoplasty, how important that is, and how we can use either silicone implant or cartilage to raise that bridge.